What is the single most quack-like thing RFK Jr. has done since joining the Trump cabinet?
I think the worst thing is his continual lack of advocacy for vaccines in the midst of a measles outbreak.
Mm-hmm.
The fact that he has not equivocally stated that vaccines are safe, effective, life-saving, that people should be getting routine childhood immunizations. The fact that that hasn't happened is really tragic and unthinkable.
I would have to totally agree with Leana. I think RFK Jr.'s not only not supported vaccines, he's affirmatively gone against them. In a Fox News interview last month, he said that they cause deaths every year, which is totally not true. I would rate that pretty quacky.
All right. Well, there's an embarrassment of riches, unfortunately, but I'm going to go with his promotion of cod liver oil and a cocktail of budesonide and clarithromycin to prevent measles, because it makes me feel like we're back in the 19th century with patent medicines, and soon he's going to come out and promote Hamlin's Wizard Oil and Dr. Rush's bilious pills. You heard it here first on Impromptu. This is Impromptu from Washington Post Opinions, a show that brings you conversations about the news we can't stop thinking about, no matter how many unproven remedies we administer to ourselves. I'm Dana Milbank, and this week we're talking about, God help us all, the man in charge of our country's health and well-being. It's somehow only been 2 months since Robert F. Kennedy Jr. was confirmed as the U.S. Secretary of Health and Human Services, and he has wasted no time causing havoc. Though his stance against processed foods has gained substantial support, his erratic pronouncements and actions on vaccines and autism, among other things, have raised alarms and may have worsened the response to the current measles outbreak. As if the cuts of 20,000 jobs at HHS weren't bad enough, the Post reports that the Trump administration is making plans to cut a third of the federal health budget and 40% of NIH. What would be left after tens of billions of dollars are slashed from federal health spending? I'm joined by two knowledgeable colleagues to discuss.
I'm Leana Wen. I'm a physician and a contributing columnist with the Washington Post, and I'm really delighted to be here with my editor, who I'm sure will now introduce himself.
Yes, hi, I'm Rob Gebelhoff. I am an editor here at the Washington Post and also a member of the Washington Post editorial board.
Wonderful. Thanks for joining me. I have many questions, in particular for Dr. Wen. First of all, I have this nagging pain in my knee that I'm wondering if you could take a look at if I hold it up to the camera. But actually, before we get to that, let's talk about the cuts under RFK Jr., which are already causing major issues at the CDC, the FDA, and NIH. Medical research has been cut, as has data collection on everything from STDs to certain cancers. And more cuts are planned to food safety inspections and efforts to make infant formula safer. Are we already seeing the consequences of these actions, or are these just sort of theoretical threats at this point?
Well, I think that we are already seeing some of the consequences in terms of research being paused, research being stopped. A lot of the other consequences we're going to see in time. For example, I'm very concerned with what you were saying, Dana, around the cuts to inspections for food and drugs. I mean, you think about what DOGE is doing, and these indiscriminate cuts are not taking into account all these vital services that protect the health and well-being and safety of Americans. And at some point, we are going to have a crisis. It's only a matter of time before we have tainted baby formula or drugs that should not have passed inspection but are. And I think we're going to see sooner rather than later what those consequences might be.
Yeah, I totally agree. And I am concerned about the long-term effects of this. One of the cuts that they made was essentially gutting the CDC's working group that addresses lead poisoning for kids. That's going to have an impact for decades.
Mm-hmm. Recently, RFK Jr. also provoked a furious backlash for saying that autism is a preventable, environmentally caused epidemic that destroys families and leaves people unable to hold jobs, pay taxes, and play baseball. What did you make of that statement? Should we have expected it based on what he said in the past?
I found it pretty offensive. Our copy chief, Trey Johnson, he wrote a piece based on his experience with his kid who has neurodivergence. And you can tell from the piece how just insulting it was for RFK Jr. to kind of write off a lot of these people who have been living with this condition. And, it's not something we want kids to have, but I do think the tone that he had describing it was just really awful. His views are not based in science.
I've been interviewing researchers who have devoted their careers to understanding autistic spectrum disorder, as well as to families and autistic people themselves. And I think that they take offense to a number of things that Secretary Kennedy has said, including his characterization of autism as an epidemic, as a chronic disease. These are not terms that they agree with. They think that the connotation when somebody says this is an epidemic is somehow that this is like COVID, right? That this is something that's contagious, that it's spread, that there's some way to prevent this from happening. And the connotation is not scientific. It does not comport with what we understand, but especially when they hear terminology about autism being entirely preventable, which is along the lines of what Kennedy has said, they hear it as, well, you're saying that my life should have been prevented. And I think it's extremely offensive and also brings up the point of why is Kennedy saying these things? As in, if he's saying that he alone is going to be able to figure out the cause of autism, which is something that researchers have devoted their careers to studying, and that this is somehow going to be known in the next several months, then one can only think that he already has a predetermined conclusion. And that given what he has said in the past around autism and vaccines, which is obviously something that is totally debunked and not true, that somehow he is going to come up with the idea that vaccines are the cause of this so-called autism epidemic and that we have to do away with vaccines. And so I think it raises concerns in a lot of different ways, definitely among advocates who are rightfully offended, but also among the scientific community who are really worried about what the conclusion is going to be based on his so-called investigations.
So, Leana, you wrote about how the mixed messaging and lack of action exacerbated the measles outbreak, and RFK Jr. is still spouting all kinds of misinformation about that. But he occasionally does some backtracking on his dubious claims. He walked back the autism claim a little bit. He's done a little bit of that on the measles. Do you get any sense that maybe that he's learning on the job, or will this man never grow into an HA secretary who can pay taxes, hold a job, and play baseball?
I think that what's happening is that he is trying to speak to different constituencies. On measles, he probably received pushback, and rightfully so, from many in the scientific community. One would hope from people like Secretary Dr. Cassidy, who during his confirmation hearing very much pressed him on issues around vaccine safety. And it sounds like on the one hand, he's walking back some of his more extreme statements around vaccine safety. But at the same time, I also spent some time interviewing individuals who really like it when he questions the safety of vaccines, and they are now worried that he is too supportive of vaccines. And so it seems that he's trying to speak to different constituencies at the same time. And he's saying, on the one hand, for example, around measles, he is now saying, okay, measles vaccines are the best way to prevent measles. But at the same time, he's also, as you mentioned, Dana, talking up these other so-called treatments that are not based in science. I mean, budesonide is an inhaled steroid that's given to patients with breathing problems, but it's not a way to prevent measles. Clarithromycin is an antibiotic. It does not treat a viral illness. And cod liver oil, really, I mean, this is something that when taken in large quantities, because it's got large quantities of vitamin A, one could get liver toxicity. And in fact, we've seen now some children being diagnosed with liver toxicity from taking it. And so I think he's trying to play to both constituencies, if you will, and I suspect that that's what we're going to see continuing going forward, whether it's on autism or vaccines or other issues.
Well, doctor, I'm very glad you said I can stop the cod liver oil supplements, because that stuff is nasty. Rob?
Yeah, I do think this playing to two different constituencies shows is there is a political gravity here that RFK Jr. just cannot ignore. He has to deal with not many Republicans, but a handful of Republicans in Congress who really do care about getting the messaging right on vaccines and on the measles outbreak, Senator Cassidy being one of them. And I think there is a real cost to the administration for not handling this appropriately. I think what RFK Jr. has been doing so far has been terrible. I really do think that the measles outbreak is only going to get worse. But I'm actually somewhat heartened by the small signs of life that there is resistance to the anti-vaccine movement, even on the right.
All right, we've got much more to discuss, including possibly things that RFK Jr. is saying that are correct. But first, we're going to take a quick break. Welcome back. I'm Dana Milbank, and this is Impromptu. We're talking about RFK Jr. and his chaotic leadership. On the positive side, Kennedy has amassed support behind his Make America Healthy movement. Leana, I know you've been closely following this movement, especially the MAHA moms. I don't know if I said that correctly. Might some actual health benefits come from this, or will these be outweighed by all the harm he's doing in other areas?
Well, that's the question. I think there's no doubt that there are some issues in this Make America Healthy Again movement that Kennedy and Trump champion that basically everyone can get behind. I mean, who would not be in favor of having children eat healthier meals, of reducing ultra-processed food that we know is associated with all kinds of chronic problems, making sure that school lunches are nutritious, cutting out food dyes and microplastics? I think those are things that we can generally all get behind. The problem, though, is that the MAHA movement also includes many individuals who are strongly anti-vaccine. And I wrote a piece on the MAHA moms, the moms who are fervently, ardently supporters of RFK Jr. And it's very interesting how he's amassed this quite heterogeneous coalition of people. You have what I divided into three categories. One is the so-called natural crunchy moms, right? These are traditionally left-leaning women who want things that are all natural for their children. And for them, they're beginning to see vaccines as something that's unnatural or toxic. There's a second group that's traditionally apolitical who have experienced some type of medical event in their lives that made them distrustful of the medical establishment. And they now also see vaccines as something that is harmful to their children. And then, and it's very difficult to convince someone to prove a negative when they're that convinced. And then there's the third group, which are the people who are traditionally MAGA, right? The people who are, I think in particular, very incensed because of restrictions during COVID, for whom opposition to vaccines was already front and center, and who gravitate to Kennedy because they think that he is their champion to oppose vaccines.
Yeah, that was a great column, Leana. Yeah, I've already told you this.
And very well edited, I might add.
Oh, thank you.
Very well edited. Thank you.
It's so interesting to get into these, groups of people that we don't hear from very often. I think they're going to be so important to the political climate, for years now. And I really am interested to see how they react to however this, Kennedy administration at the HHS feels, because I think if there's a large interest in Kennedy tackling these chronic diseases, these long-term health issues, the addressing ultra-processed foods, and he doesn't deliver on it, where do these people go? I feel like a lot of them have already been disillusioned from mainstream political characters. And if this person who's outside of that cannot deliver, what happens to them? I see some scary signs that Kennedy's not going to be able to deliver on his promises here. For instance, just last week, one of the top nutritionists at NIH, he retired early and was very critical over Kennedy for what he viewed as censoring his research. And this was one of the top researchers on ultra-processed foods. He cared a lot about how to lose weight, over time. He cared a lot about whether ultra-processed foods were addictive. And he felt like he didn't fit in this administration because RFK Jr.'s views were so strict and he wasn't willing to accommodate the science. So he needs scientists, real scientists, to deliver on his promises here. And he can't just get rid of them or lose them if he wants to make this actually work.
I agree with you, Robin. I would add another concern on my part, which is I'm not sure that chronic diseases that you and I would be talking about or that we're discussing here, which namely in the US, the chronic diseases that are affecting people's health are obesity and high cholesterol and hypertension and diabetes, right? A cardiovascular disease being the number one cause of death. I mean, that's what we would traditionally be thinking of chronic disease. I listened very carefully during the confirmation hearing of Kennedy because I wanted to understand, right? I definitely wanted to see whether he would recant his prior statements around vaccines, but also wanted to see, well, what exactly are his plans to tackle chronic disease? Even, Dana, to your point earlier, even if there are some negative things that Kennedy might do, might there be some positive things that might outweigh these negative things? But I truly could not hear what his plans are around chronic diseases because when I listen very carefully, when he refers to chronic diseases, I don't think he's talking about diabetes, hypertension, obesity. I think he is talking about chronic diseases as he defines them, like autism, like rheumatoid arthritis, like things that he believes are attributed to environmental toxins, that he can then say, okay, well, now we need to get rid of these environmental toxins of which vaccines he might classify in them. And I wonder if that...
Or fluoride.
Yeah. Right. And I wonder if that is how he plans on delivering on these promises to conquer these chronic diseases, and which is the reason why he may have no need for this NIH scientist who is incredibly well-renowned, but he has no need for people who would deliver on what we would call evidence-based science on nutrition because he has some other plans in mind.
Oh, great. So the one thing that I thought he might have been doing well has now been taken away. Not that I am in need of something new to worry about, but let me check in with you guys on what's keeping you up at night when you think about the huge cuts to public health and HHS in generally and the wacky leadership there. Is it going to be a bird flu pandemic? Is it the years we're going to lose on medical research and how long it would take to rebuild it? What's most concerning right now?
I think what's most concerning to me short term is infectious diseases, because that is what we're going to see really spiral out of control, potentially very quickly. We're already seeing that with measles. There's no sign that this current measles outbreak originating in Texas is going to be controlled anytime soon. The U.S. could lose our elimination status for measles, which would have implications on travel, the economy, and so forth. Not to mention, of course, many more people getting ill and potentially dying from a vaccine-preventable disease, which would be really tragic. We also have really no idea what's happening with bird flu. We don't know the extent to which there are new cases. And of course, if that is another one where the situation could get out of control very quickly. And so I think infectious diseases and our lack of insight into what is happening is top of my worry. But I think that even medium term, longer term, it's exactly what you said, Dana, about the cuts to research and the decimation of potentially generations of work and into the future.
I think that's exactly right, Leana. I'm concerned about infectious diseases too. There's one, obviously, measles, I think, is front of mind, but one that I think is not getting a lot of attention is syphilis. Syphilis is spiking and has been for a couple of years, and I'm very nervous that the loss of workers at the CDC means that these less in the forefront diseases are going to lose attention. It's easy to tear down things. I think that's what we've learned from the first couple of months of this administration overall. It's easy to lay people off, to withhold funding, to say we need to change everything, so we're going to tear it down. It's so much harder to rebuild and to create a government that actually works. And we are not at that part of the Trump administration yet. We don't know what their plans are for a lot of these agencies, especially at HHS. We're starting to get little inklings of it. I don't want to prejudge it, but that's what's scaring me, is how are they going to rebuild this? And who are they going to rebuild it with after having gotten rid of some of the best minds in our health field?
All right. Well, now you've both terrified me so much, my palms are sweating. So what's your advice to people who feel like, all right, well, the government is not going to keep me safe. How do I keep myself and my family safe? What do you say to them?
I don't think that all is lost. I think that there are still many great people who are working in the federal government who are trying their best despite really difficult circumstances. And we are still seeing good reports, good updates coming out of the CDC, coming out of the FDA. And so I think we should take some solace in that. There are also medical organizations that are stepping up. We're seeing, for example, the American Medical Association publishing updates on measles guidance, something that they previously probably would have relied on the CDC for, but at least you're seeing some medical organizations step up. The American Public Health Association has been really vocal in standing up against Kennedy. We're seeing the American Academy of Pediatrics also speak up about issues related to childhood vaccines. So I think turning to those entities, people should look to accredited medical organizations, reputable medical organizations for information. And hospitals, despite, of course, also having their budgets being threatened through research, they're also still putting out valuable information.
Yeah, I agree. And what we learned in the pandemic, or at least what I think a lot of people learned in the pandemic, is our health infrastructure is a very decentralized system. And that has some weaknesses, but it also has some strengths. In this case, we can rely on states to at least somewhat fill in the gaps here. So, that doesn't help people in Florida or in, red states that might, follow RFK's lead on vaccines, but other states might be able to do some good.
Well, I don't know what I can offer, but I've been taking this Hamlin's Wizard oil for quite some time now, and I've not gotten the measles yet. So I think according to the RFK Jr. philosophy, it should be an approved treatment. All right, with that, we've got to wrap this up. Thank you both for joining this episode of Impromptu.
Thank you.
Thank you very much.
This episode was produced by Hadley Robinson and Regina DeHeer, edited by Damir Marusic and Chris Solentrop, and mixed by Emma Munger. Special thanks to Millie Mitra and Deirdre Byrne. Thanks for listening to Impromptu. Please let us know what you think about RFK Jr.'s antics. Send an email to impromptu@washpost.com. And remember to tune in to the Friday edition of Impromptu with my colleagues Drew Goins and Molly Roberts. Talk to you next week.